Hey everybody, it's Dr. Eric Balkavage, and we're back for another edition of Thyroid Answers podcast. And as always, I have my faithful co-host, Dr. Erica Riggleman, with us today. As usual, Dr. Erica, how are you today?
I'm doing great. How are you doing today?
I am doing fantastic. We have another guest today, and she comes from across the pond. She has a clinic in Limerick City, Ireland. Our guest today is Olivia Beck. She is a nutritionist and the organizer or founder of Thyroid Ireland, or Thyroid Nutrition Ireland, which is an organization to help educate the nutritionists and practitioners in Ireland about thyroid physiology. She and I will end the podcast a little bit, or talk during the podcast a little bit about an upcoming venture we have this coming fall. So Olivia, welcome to the Thyroid Answers podcast. How are you today?
Great, thanks, Eric. It's a pleasure to be with you today.
Well, we appreciate you coming on the podcast, and we will promise not to talk with any Irish brogues and kind of play along and kind of screw that up. So we'll talk with our normal English American accents, I guess we should say. So can you give the listeners a little bit of background about you? You're a nutritionist, you have a clinic in Ireland, and because of our discussion, you definitely work with people who have thyroid issues. But how'd you get into this space? And tell listeners a little bit about your background and your practice.
Okay, great. So I opened up my clinic in 2013, and I suppose just organically it happened that I had more and more people with thyroid conditions come to me, and it is an epidemic here, as I'm sure it is there as well. I just realized that more and more people felt let down, were very symptomatic, despite being told that medication was all they needed, and that diet and lifestyle had nothing to do with it, when in fact I soon realized that it had everything to do with it, and I was able to help people a lot. And obviously, ideally, as a practitioner, you want to be able to get good results. And so that's just naturally how I've taught and began specializing in thyroid conditions and released my first recipe e-booklet. So I've got a couple of different e-booklets on the site. And then, like you said, Eric, last year, I founded Thyroid Nutrition Ireland, which is an organization. At the moment, I have 11 nutritionists based in different locations all across Ireland, and we're there to really help the public to, I suppose, make them feel better. People with a thyroid condition, whether it's hypothyroidism, autoimmune, subclinical, they can reach out to us, and we're qualified, insured, and skilled at helping people to improve their symptoms that come with the thyroid condition, whether they're on or not on medication.
Awesome. So thyroid problems are a huge issue here. They're a huge issue there. How common, like here in the United States, we say that it affects maybe 10% of the U.S. adult population. I think that, and when I think we look at that, I think that number is actually low because we're not considering a form of hypothyroidism, which we talk about on the show quite a bit, which is cellular hypothyroidism, or the deactivation of thyroid hormone in your cells and tissues, which we feel many times occurs long before TSH becomes elevated and T4 drops and you get diagnosed with primary hypothyroidism. But what are the statistics like in Ireland? What do the numbers look like in Ireland?
Yeah, well, I mean, if you think about Ireland being an island and quite a smallish population, they're now estimating about 500,000 to 500,000 people in Ireland have some form of thyroid condition. And like you said, I'm sure that the numbers are much higher than that. Because a lot of people, like you said, maybe get told they're borderline or they're symptomatic and are told everything's fine because of the reference ranges here and that. And so I would see people who, are not diagnosed or have been diagnosed. So I would say statistically, you're probably kind of upping that to maybe close to 1 million. And with the population being under 5 million, that's quite a large percentage of the population here in Ireland. Yeah.
That's a huge chunk of the population, right? That's a big chunk of the population that and that drives those numbers up even probably a little bit higher. But I think that puts that probably more in line with what we see in the States, is that people are typically not diagnosed as having a thyroid disorder because their TSH is still holding on it's within normal lab range. Whether it's subclinical or primary hypothyroidism, that's when the diagnosis occurs, right? But there is tons of people walking around that have low thyroid symptoms or have cellular hypothyroidism that's just being hidden by either the medications they're taking or the inflammation or the stress, which is early on, and we talk about this on the podcast regularly, that typically people under stress, inflammatory levels are up, and as inflammatory levels go up, we actually see an increased conversion of T4 to T3 in the hypothalamus, driving initially TSH down, hiding the rest of the thyroid picture because the doctor's only running TSH with a reflex to T4 potentially. So
exactly. Yeah, and I see that often as well. And as long as the TSH is low, and even if it's really, really low, it's like, well, it's not a problem, because that's often the only thing that they do run is the TSH. And so even requesting anything more than that, their training is, monitor the TSH and medicate accordingly. And then I suppose the problem is that when they go on the medication, they're told this is forever, and no matter what you do, no matter what you eat, your lifestyle, that has nothing to do with it whatsoever. And so there's this inconsistency with regards to the messaging, because then we're saying, well, actually it does, look at your lifestyle, look at your diet, and all of that. And ultimately, I suppose it's going to be a constant challenge, because you're getting mixed messages. And so everybody's singing from a different hymn sheet. And that, of course, raises anxiety and confusion amongst people as well. But once they start feeling the benefits, it's really about people taking control of their own health. If they feel that their primary healthcare provider isn't giving them the support that they need, there are always options, but ultimately that's their choice as well.
I know as we look at the healthcare system, I know here in the United States, people have the ability to go where they want, but obviously it depends on, whether they have to pay out of pocket or insurance. I don't know much about the healthcare system in Ireland. Is it where people have freedom to choose, or is there more of, this is the doctor you're going to go to and these are the labs you're going to get, where the freedom maybe has been taken away from the patient a little bit?
A bit of both. It depends on the person's personal circumstances. Like, I have a number of GPs that I work with who maybe think about different types of medication, not a one size fits all, and talk about diet and lifestyle and gut health and all of that. But they might be 3 hours away from where the patient is based, and therefore they wouldn't be covered. So like you said, it depends upon person's personal expenditure and income, and whether they're in the medical system, whether they have a medical card, and all of that. So they're all of those different factors that you have to think about with regards to how much access they have, and so that's always going to be a difficulty as well. Yeah.
So if you have somebody is struggling with chronic symptoms, and are you their first choice? Are you the last choice? And at what point where in that pathway do they start to find the nutritionist in Ireland? Is that primary, or is that like more like functional alternative type therapy?
Yeah, I think it's kind of like, okay, we've reached the end of the line now, and we're kind of at a loss we feel let down by the medical system. We don't know where to turn. Oh, now we've heard. Now it is changing. I've even noticed a change in the last 6 years. Like, it definitely is changing. I think people are starting to, the seed has been planted. There are certain endocrinologists and doctors that I work with that are asking me the questions that need to be asked, and I'm happy to answer them about TPO antibodies and what are they for, and how their hands are tied with regards to the whole system. So it's very much more of a system problem than a them versus us, which I think is important as well for the patients and the clients to realize as well, rather than kind of feeling like it's alternative. I always say it's complementary, it's a holistic approach. But I'm definitely not the first port of call, depending on the person, how proactive they are, and how they've been brought up. Obviously, you've got certain generations where they would be like, well, the doctor has the final say, and then you get certain other generations that are much more open-minded, and would sometimes, the ideal situation is come to you when things are starting to get a little bit out of kilter, and that's the ideal situation. But obviously I would deal with people with kind of thyroidectomy, different nodules, 20 years later, and they just keep upping the medication, and they're just stuck feeling that it's not helping them at all. And that's the problem, is often the medication doesn't help because synthetic altroxin is what is mostly prescribed here. So it's a synthetic C4, and it doesn't work for many people, or it might initially work and then it stops.
If people, so the medical establishment, we talk about this on the podcast quite a bit, that, hey, you know, there really is a place for everybody here. You know, the acute care is that medical model, and then how do we identify the cause, address the root cause issues, diet and lifestyle. That's really the role, at least in our world, of the functional medicine model, and I guess the nutritionists in the US. Is there a functional medicine practitioner? Are you seeing more functional medicine practitioners, or are the nutritionists in Ireland really taking that role as the functional medicine practitioner?
Again, I think a mixture of both. There are some medical doctors who are trained in functional medicine, and a member of N2I has launched the Functional Medicine Ireland, and this is, I think, the 4th year that they have the Functional Medicine Conference coming, and so there's this awareness has been built around that. I've been trained in functional medicine. A lot of the members of N2I and Thyroid Nutrition Ireland are trained in functional medicine as well. So like you said, there's a place for everyone, and I think functional medicine is becoming better understood. And it's just the best model, really. I mean, even as somebody said to me, oh, well, how does the Thyroid Nutrition Ireland model fit in with the functional medicine? Well, I suppose it's a great way to get people in the door, but obviously with the thyroid is never only about the thyroid. It's looking at all the systems and looking at all, you know, the different parts and how they contribute, and how people don't realize that if you don't have a gallbladder, that's going to affect the thyroid, not directly or maybe indirectly, but it's all linked, because it is like a domino effect, isn't it, really? So we always look at it from a functional medicine point of view. The members of Thyroid Nutrition Ireland and myself personally, we use the functional medicine timeline, we map it out, we hear the patient's story, we look at the bloods, we do functional tests, you know, we do everything. So we do work on the functional medicine model as well.
Okay.
Yeah.
So you go ahead.
And I think that's a very common thing that, you know, we do here when people come to us. We want to map out those things. So when a person comes to you, what sort of symptoms are they normally presenting with? Are they typically diagnosed already, or are they frustrated essentially? And how do you evaluate them? Do you have to refer to get blood work out, or are you able to work with them on that aspect?
Yeah, so usually the majority of my clients would come to me having already been diagnosed with hypothyroidism. Often they don't know whether it's autoimmune or not, so that's really important for me to do. So I can run that test privately, or I can write a letter to the GP and say, well, these are your options, but at least if it's not getting done through, you know, the lab, then we can do it privately. And then we do usually do also comprehensive gut tests and adrenal tests and advanced hormone metabolites and a few other tests as well. It depends, of course, you know, everybody's resources, everybody has a limit as to where their resources are, and these are all pieces of the puzzle, but really we're looking at they have some genetic predisposition. Like there's definitely evidence to show that, you know, usually it would be mom, sister, cousin has it, but we know that our genes don't really determine our destiny. So, you know, our diet, our lifestyle. So we really look at, you know, the comprehensive testing, what can be done, what we have at the moment to work with, because even, you know, the conventional labs, like I had a lady come in today, hypothyroidism, fertility issues, had her bloods, was never flagged there was anything wrong, but when we saw pernicious anemia, you know, low iron levels, B12, there were some immune markers off. So there's a lot that you can take even from that. You know, nothing had been flagged to her. So I said, well, I can see there's already a lot that we can work on in the meantime until we run the comprehensive thyroid function test as well. And looking at sleep and lifestyle, you know, she's kind of someone who burns a candle at both ends, like many of us do. And I think that's often at the root of why it's become such an epidemic, you know, right now in this modern world, is because we are more exposed to toxins than ever before, and we're more stressed than ever before. And that's become the norm. And I think that's often something that people have to kind of reflect on, that self-care aspect as well. You know, there might be a genetic predisposition there, but then there are other factors, you know, that are again, different pieces of the puzzle. And that's what I suppose our job as practitioners is to do, is go down that rabbit hole and try and kind of piece it together and try and kind of, I suppose, support them to take control of their own health as much as possible so that they can feel better.
Yeah, I think one of the big challenges is, we all get the same question, like, what's the optimal TSH for, like, an open-ended question like that? And the answer is, I don't know. I don't know what's going on with you, your life, your lifestyle. I don't know what happened in the last 5 minutes, the last 2 weeks with you. So I don't know what your optimal range is, because I don't know your situation. The optimal, like, TSH range, you know, we all have an optimal range we like to see in, but we have to take into consideration everything else that's going on in their diet and lifestyle to determine if it's normal and appropriate or normal and inappropriate, right? So a lab value can be totally normal and inappropriate, or it could be appropriate given the person's situation. So it is a major issue. What's ironic is that, you know, patients are so often told in an allopathic model, because doctors have been taught this, that once you develop hypothyroidism, it's a lifetime disease. You're always going to need thyroid hormone medication. And we all know, because we've all treated, I had Hashimoto's personally, and I no longer have any abnormal thyroid values at all, is that diet and lifestyle is what drives. Diet, lifestyle, our environment is what has the biggest influence and factors on your development of autoimmunity and development of a thyroid condition. And the way that we can really determine that that's most likely the case is through tons and tons of patients that undergo some type of functional medicine care and wind up either reducing or eliminating the need for their thyroid hormone medication. Their symptoms improve, if not go away completely. And then they're not doing it, they're not fixing it by taking more medication. The way they're fixing it is by changing their diet, their lifestyle, their toxicity. So we look at hypothyroidism not really as the mistake, and I think that's a big challenge, and I'll let you comment on this in a couple minutes, is that so often people are trying to fix a thyroid gland, and maybe their thyroid physiology isn't broken. Maybe their thyroid physiology is doing exactly what it's supposed to do. When there's a cellular stress, a cellular threat, part of the body's innate defense is to slow the metabolism down, slow growth and development, and go into self-defense. And the way to do that is to change thyroid signaling and thyroid regulation inside the cells and tissues. And if that's going to be persistent and consistent, and the overall metabolism of the body really needs to be downregulated, maybe the autoimmune attack isn't an accident at all, but the autoimmune attack is actually the part of that cell defense mechanism to generally slow down metabolism, to slow down growth and development, whether it's to protect from abnormal cancer cell growth, to ramp up the immune or the inflammatory and immune system, and drive the process. And so the last piece on that before I let you comment is that what we see, and it's an interesting paper from 2019, is that the bone marrow, the cells of the bone marrow have the ability to produce TSH, okay, which is really interesting. So if you consider the model, the thyroid physiology is potentially being slowed down and compromised, not because there's a defect, but as a protective mechanism. And the bone marrow has the ability to produce TSH, which means, and it's hypothesized, that when the immune system addresses the threat, it's the immune system, not the hypothalamus, that upregulates TSH production to restart the thyroid gland and the production of thyroid hormone. So that's a 2019 paper. So if you think about that, why would the bone marrow be producing TSH? Well, because the bone marrow is really a huge director of the immune system. And if the immune system is the system that knows, hey, we're done fighting something, we can turn this whole metabolism back on, it would make sense that the bone marrow would then be the driver of elevating TSH levels to increase the production. So I talked a bit, but let me ask your question and your philosophy regarding what we see in thyroid physiology. Is it and this is a generalization, do you look at thyroid physiology as just a wonky dysfunction and unlucky situation of the body, or do you look at it more like, hey, what is the body trying to tell us here? Is this a self-defense mode?
Yeah, it's definitely an interesting one, and there are some hypotheses and different theories out there, and I'm in a bit of a kind of in the gray area of it all, just listening and learning and everything. I mean, now that iodine deficiency isn't a common problem anymore in the Western world, we are seeing these incidents of autoimmune conditions, okay?
Mm-hmm.
And so once we have one, then we have about 35% increase of getting another one. So I'd often see kind of multiple different autoimmune conditions, like people don't even realize they are autoimmune conditions. So then we have to turn our attention to the immune system and ask why it's decided to knowingly or mistakenly attack our own tissues, especially, you know, the thyroid. So the immune system is something that we need to look at and ask, you know, is it by accident? Is it because it's trying to, you know, either get rid of a virus or bacteria there and lurking or hiding behind the thyroid? But when we're in that fight and flight, as many of us are, and we have the genetic predisposition, this is causing us to be more compromised. So like I said, it goes back to the whole game of dominoes. Is it kind of one thing? Is the thyroid a symptom of something else that is going down? Because the thyroid is actually now shutting down. We know that in the famine times in Ireland, that's exactly what happened, is a lot of people went hypothyroid because there was no food. So how are we going to do this? We have to kind of try and conserve our energy and slow everything down, slow down digestion. Fertility wasn't going to happen because why would you want to in that time? So all of those things. So like you said, as opposed to kind of saying, well, what's wrong with it? It's kind of saying, well, what is it trying to tell us? What is going on? What is the message that it's trying to give us? And I suppose that's really looking at it from a functional medicine model. But then when we look at maybe viruses and bacteria, then the question is, well, do we try and fight it off, or do we create an environment that is not allowing these viruses and bacteria to flourish as well as maybe they could or should? And that's the case where, you know, you and I go on holiday, and why is it that I'm, you know, so much more susceptible, and my body then it's affected in so many ways, including my thyroid, and you not? And that maybe goes back to what you were saying about your personal experience with it as well, and how you've been able to overcome that. So I don't know, I hope that answers your question.
No, I think it does. I think what we're saying is, for the person who's listening, the listener, whether when you look at your thyroid physiology, the initial thing, especially from an allopathic model, is that the thyroid gland just becomes dysfunctional. It's just the way it goes. It's a combination, you know, a doctor who's astute will tell you it's probably a combination of environmental factors, lifestyle factors, and genetics, right? That combination of things. And but then they go on to say there's nothing that you can do. You're going to have to take thyroid hormone. We have to take a step back. Even if you have genetic predisposition, if it's the result of these other factors, toxins, environmental factors, lifestyle factors, then why can't we reverse engineer? And if we think about it from that standpoint, like we've got all these stressors that are impacting our physiology, which is causing our thyroid physiology to slow down, maybe what you want to start to consider as a person who gets diagnosed is not to try and fix the thyroid per se, or to fix the lab value, but to look at the things that you can control. And that is the stressors that create the problem to begin with. So look at the thyroid physiology as not, it's just totally out of control and become dysfunctional and it's creating this issue, but more probably along the lines that your thyroid physiology is trying to protect you from some type of stress. And if you get busy addressing the stress, that's going to give you the most benefit long term. And that's how you can heal, recover, and improve. But I want to ask you about your organization, because you started this organization, Thyroid Nutrition Ireland. What's Thyroid Nutrition Nutrition Ireland all about? Why did you guys start this process? And how does somebody, especially somebody in Ireland, how do they take advantage of it?
Okay, so like I said, I've been specializing in thyroid conditions since around 2014. And I mean, I'm honest, like I said, we're talking about a huge majority of the population in Ireland. Like there are about 450 nutritionists, but I suppose I'm the only one that's been shouting, hey, I can help you. So I'm booked up until May, you know. So I said to myself, well, hold on a sec, you know, let's try and collaborate, and let me try and get a group of, you know, skilled and qualified practitioners who think from a functional medicine point of view, have experience with these functional testing, and have experience with helping people with these chronic autoimmune inflammatory conditions. And this is how, I suppose, this idea slowly started developing from 2016. And so at the moment now, I have 11 nutritionists based across their own clinics in Ireland who can help people with a thyroid condition overcome their symptoms, improve their overall well-being, get to the root cause of where it is. And like you said, it's a really important point to make that, you know, the lab results are just one piece of the puzzle. It's about feeling well. Like that's the most important thing, really, because, you know, ultimately, if you never get your TPO antibodies looked at again, but you're feeling so much better and your bowels are working better and you've got great energy, isn't that all what we all want at the end of the day? So that's what we're here for, is really, I do believe that it's all about individualized approach. So that one-to-one, you know, it's not a one size fits all. It is multifaceted. It is really complicated, like we've touched on. And so it's really just to be the middleman between the nutritionists who can help the people who have the thyroid condition that are looking for help. And that's what it is ultimately is. And that's why you're coming over, to make sure that they're, you know, highly trained, highly up to date and up to speed with everything, that they're thinking in a way like that you've spoken about, which I think a lot of people probably have never thought about, is, okay, hold on a sec, you know, let the thyroid do its thing, or let the antibodies do its thing, but look at, again, your stress, because ultimately sometimes it's the last piece of the straw is the thyroid, but it's what happened up until that point, what happened 20 years prior to that. You know, that is what, as nutritionists and Thyroid Nutrition Ireland, we're trying to do, because that's what's ultimately going to get the thyroid working better once you look at those physical and psychological stresses that are going on within your body at a cellular level, like you said.
I think that's awesome. And again, I think that's a big piece that the traditional medicine often misses, is that, again, it's looking at those stressors, but also the being able to look at all of those different sides and be able to put the puzzle together and educate people, because I think that's part of it, is that there's just not a lot of education out there. And there's just so many struggles. And you said at the beginning that people often are confused and torn between what their primary care is telling them versus what you're saying. And, you know, when they're confused, people don't really know what to do. And they often just, they sit and do nothing because they're afraid to make a decision, because they don't know one way or the other. What do you see as the biggest challenges that you see in Ireland and being able to take your organization and be able to move forward and keep getting people, you know, signed up and being able to help people? What is the biggest challenges you see going forward?
I think the biggest challenges is really for people to realize that we are there to help them. You know, when you're being told, well, there we go, you have to take this pill forever, and, you know, that's it, get on with it. It's very difficult sometimes to, like you said, despite being told one thing, to really, you know, follow your gut instinct and say, well, actually, I might look at something else. But also, I think that because there are so many people with a thyroid condition in Ireland, you know, people are getting given little bits of information. Well, I don't eat vegetables because they have those goitrogens in them. And, oh, I've heard that this is great, not good, and I should go gluten-free, but that didn't really help. So our new diet, I think that individualized approach is really important, because we can easily Google, you know, what I should do for my thyroid. But again, it's really important to know that it's quite individual for every person. So although it's great that people are giving advice, it's really important to take it with a pinch of salt. Follow your gut instincts, what feels right for you as well. And often, like you said, it's just about educating people and knowing that, you know, there's someone that can help you follow a tailored plan for you. And sometimes you just have to kind of ignore the noise around you, because that can often be overwhelming, because the typical symptoms would be, you know, low mood, a sense of kind of feeling overwhelmed and anxiety, and sluggishness. So it already takes a lot for people to reach out to us. And so we're there then to, you know, help them do whatever they can do and facilitate that change in whatever pace that they feel able to do, you know, because again, throwing in the whole kitchen sink, you know, often doesn't work, can overwhelm people. So it's just really about saying, well, what can you do right now? And we always put together a tailored plan that we feel is suitable for the person at the time, where they're at. And, just take it step by step, because if you've had the condition for 10, 20 years, there's no magic pill. It's not going to work in one consultation. The best outcome I've had with taking people into remission is working with them for a minimum of 3 to 6 months. So it's an investment in time, but it's an investment that will be well worth it at the end.
Yeah, I don't think that time frame is unrealistic at all for most people because of what they're up against. I mean, you could definitely make changes in a few months, but it does take time for the physiology of the body to really change and adapt. And sometimes when you take the stressors away that created the healthcare problem, the body doesn't always just come right back. There's been enough dysfunction that occurs that we really have to help support a blood sugar regulation system, a GI system, a hormone regulation system to get back on track. So Thyroid Nutrition Ireland, the primary focus there is to really help educate, to build a bigger community of practitioners that have a really good foundation in understanding thyroid physiology. You said there's 450 nutritionists in Ireland, I think you said, right?
Correct, yes. So the nutritionists that I have taken aboard in my team have been qualified and practicing for a number of years and have run those kind of comprehensive testing. So it was a screening process, and I need to make sure that, that anybody that was with my team, was able to take a booking and help a person just as much as I would be able to in my clinic.
Okay, so what you're really trying to do is teach a philosophy, an evaluation and process to be able to look at labs, to look at a patient's health history timeline, and then bring them through the process. So somebody who's in Ireland, who's got potentially hypothyroidism or chronic hypothyroid symptoms, is struggling in the model, if they look for somebody who's got that designation of being part of Thyroid Nutrition Ireland, they're going to get the consistency from practice to practice as how they're going to be looked at and evaluated. Is that correct?
Absolutely. Yeah, that is my guarantee. And then that's really important for people to know. And even if you just go onto our website at thyroidnutritionireland.com, you'll see every member of the team have written a really comprehensive article and have put together a recipe. So, just, test that out. If it's completely something that you haven't heard of before, you're not sure, have a read, some of the blogs, look at them, look at the different members of the team. You can see where they're based. There's a bit of a bio about their previous experience. Some of them have therapists in terms of have psychology degrees and things like that as well. So they bring their own special element into it as well, which is quite nice. And I think three members have thyroid condition themselves. So I think that's fantastic because they can talk about their own personal experience within the medical system and how nutrition has helped them personally as well, which I think a lot of people really enjoy, that they can feel they can relate to the practitioner as well.
So are you seeing, is there within the nutritionists that are in Ireland, 450 of them, are you seeing that there's a number of people that want to move or are looking for that type of help and education, or that structure and that teaching model of how to really look at and address blood work physiology in their patient? Are you seeing people like, hey, we want this type of education, we want to join this type of organization?
Absolutely. I mean, I'd probably say that off the top of my head, I had about 150 not applicants, but people that were interested. And I suppose it's really just to explain that there isn't a protocol, because there isn't a do this, then do that, and then do that, and then off they go. And that's I suppose what might often have maybe put some of them off, because it's like, oh, well, so there's not a protocol that I can just follow. And that's the thing with the thyroid, and that's probably why I'll never get bored of it. And I'm sure it's the same for you too, because we don't know. There isn't a perfect reference range. Like you said, there isn't an answer. It is, very, very complicated, and there's still a lot of research being done. So it's for them to understand the complexity of it, as well as have experience, as well as want to improve in terms of their training and their education and research around that. So they've all got a thyroid starter pack, which is kind of the kind of penultimate basics that I've given to all of them in terms of, you know, what to look for, where to start, where the research is at, and what things to look out for. And then you're coming over and we're going to continue to do that and make sure that we're kind of the best, you know, and are able to offer the best service to the people that are really reaching out and need it in Ireland, as I'm sure the same for you guys over there as well.
Yeah, I think what you're doing is really a nice idea, so that somebody who has hypothyroidism, struggles with the symptoms, knows where to go. Because currently, and Erica will probably tell you the same thing, people are saying, well, I went to a functional medicine practitioner and I didn't get success, or I went to this functional medicine practitioner is good, but there really isn't like a set diagnosis, or what's the word I'm looking for, Erica? There's a
like
set
an organization that,
yeah, organization or credentialing that you're within the world of functional medicine. You're somebody who's a thyroid specialist, right? I don't know that we have that, and maybe that's something that we need to get started. But the issue is, I think it's really nice that you're doing that, because yeah, if somebody's struggling with what they think is a hypothyroid condition, not every functional medicine practitioner, not every nutritionist is going to evaluate the same way, have the experience with thyroid physiology to realize that even though your TSH is normal, that doesn't necessarily mean you don't have a thyroid physiology problem, right? Or the fact that your TSH is elevated, oh, that means we need to put you on a glandular product. That may be the last thing you actually need. And so we should have a program or an organization like you're starting to develop, to say, hey, if you got a thyroid issue and you want to go to functional medicine, you want to look for this credentialing, right? That, I think that, so I really applaud you for what you're doing. I'm thrilled to be coming over to work with you to help kind of be part of that process. And we might have to talk about how to do that same thing here in the coming future. But can you tell the listeners, some of these are obviously patients, people that are struggling with hypothyroidism, some are nutritionists, but the podcast plays everywhere. I know there's people from Ireland and England. I just was on a podcast, Get the Beans, I think is what it was, with Vaughn. God, I think of Vaughn's last name, but on his podcast, I mean, I think he's in Scotland. He's like, hey, if that works out right, I'm coming over, or I'd like to come over and be part of that process. So what's the seminar look like? What's the dates? What's the game plan for the seminar?
Okay, so we've got you coming over on the 12th and the 13th of September. So the 12th of September is open to practitioners, nutritionists, members of NTOI, and any practitioners, you know, that are interested in helping people with a thyroid condition. So, you know, it could be open to really anyone who works one-on-one with patients and have seen and dealt with that a lot, and want to know how they can perhaps help as well. And so we've already got quite a few bookings already there. And then I suppose the second day is exclusively for the TNI members, the Thyroid Nutrition Ireland members. So I'm sure some people who are listening to the podcast might be like, oh, I need to get in there. And so let me know if that is something that you're interested in. But yeah, that's exclusively for the members. And that's really just, I suppose, to give it that more advanced training, because again, that's what we do, is we're specialists in the area. And so we want to continue to make sure that we've got you know, the best information there, and that you can provide us with all your wisdom, and that you do through all your podcasts and everything, which is fantastic. And so we're really looking forward to having you over, and it's going to be a fantastic day, because I suppose ultimately, you know, I don't know what it's like there, but here we have to do a certain amount of continuing professional development points every year. And so, you know, we're always attending these different conferences, like the functional medicine one that's held by Maeve Craven, and other senior nutritionists. And so, but this has never been done where it's been focused specifically on thyroid. And so it's going to be fantastic. One that isn't, you know, maybe, I suppose, run by a supplement company, because, you know, so now we're not going to be biased in any way, really, are we? Because we're just going to say, well, you know, this is what you're going to be looking at. We're going to be looking at case studies. It's going to be really in depth, and I'm sure it's going to be a fantastic 2 days. And so we're looking forward to having you over.
Well, thank you. And I think it's really important for the nutritionists or the practitioners that are listening to the podcast. We're, you know, too often I think what happens is somebody has a normal TSH and they assume that everything else that's going on with the person, their high cholesterol, their blood sugar dysregulation, their adrenal issues, their biliary problems, their gut problems, have nothing to do then with their thyroid physiology. And really what I want to get across is there's no way that you can have those things going without some problem or alteration of thyroid physiology. So we're going to spend some time, you know, on both days kind of talking about how to assess, how to look at things, and definitely get an idea of how thyroid physiology. We're going to talk about this model of cellular hypothyroidism. We're going to talk about the hypothyroid spectrum. We're going to talk about thyroid autoimmunity and primary hypothyroidism. We're going to talk about the labs. We're going to talk about why you just can't take labs at face value. And then we can talk about not just the thyroid labs, but how everything else, the big picture of those labs, can give you an indication that yes, there are thyroid physiology problems here, even though blood TSH and T4 may actually be normal, right? And for you, you know this because you see it every day. Dr. Erica is, you know, she's been doing this a long time as well. And, you know, we both have worked with people who, you know, my doctor says everything is normal, right? And yet I feel terrible. Well, if everything's normal and you feel terrible, then you didn't have the right test done, or they weren't interpreted appropriately. So we're going to cover all of that type of information in the seminar. So I'm super excited for it.
Oh yeah, no, it's going to be great. Like you said, all of those things. And I think that's the most important thing, is to say, well, it is all related. And I think we can't stress that enough, is that if you're being told everything's fine, but you know it's not, that gut instinct, we know the research is there, follow your gut instinct, get a second opinion, reach out to yourselves, myself, whoever, and, you know, to interpret the bloods, because like you said, often they can tell us a lot, you know, just to give us a clue as to where other things could be going wrong, because sometimes it has nothing to do with the thyroid, and then when you look at, you know, correcting that other function, then it's amazing how the thyroid just, you know, bounces right back again.
Absolutely. So if we want to wrap this up, Dr. Erica, you got any final questions for Olivia?
No, I think this has been really, really good. And I think what you're doing is fantastic, because we often live in our own little cultural world. And, you know, obviously thyroid issues are not just a American thing. It's all over the world. And obviously there's something deeper that we've got to take a look at. And other places, sometimes people aren't taking that full 360-degree approach. And I think it's great what you're doing to not only have the network to refer people to the right person, but also the education purposes that you're working with. I think that's awesome.
Yeah, I think that's a great commentary. You know, hypothyroidism's everywhere. It's become problematic everywhere. I mean, it's crazy right now. We're talking about the coronavirus, which has become problematic, but the number of cases of coronavirus don't touch the number of cases of people struggling with some level of hypothyroidism. And it is, hypothyroidism is an epidemic or pandemic, however you want to say it or look at it. It is a major problem in our country, in your country, and across the world. And we have to change how we take a look at hypothyroidism and start to actually say, okay, let's get to the root issues. And that's what all three of us are trying to do, is help educate the public, help people who are listening to this podcast and are struggling with hypothyroidism, help them realize that what you're struggling with is a real issue. If you feel lousy, if you're tired, you're fatigued, something is wrong. I don't care what your TSH level is, something's actually wrong. And what our role as the functional medicine practitioner or the nutritionist should be to help you identify what those root issues. Your allopathic physician, they may be fantastic, but this is outside of the wheelhouse of that they really practice in. They're awesome at acute care, emergency care, and that's their place. But when it comes to actually fixing the root issues and taking the time with an individual client to find out what's their individual thing, that is way outside the wheelhouse of allopathic medicine, especially in the US, because a medical doctor doesn't have the time. They're not getting paid for that type of time. And the mill is to get them in, get them medication, get them treated, and move them along. And really, functional medicine, functional nutrition, all about getting to root cause issues. And so we have to continue to spread the message here, Ireland, and abroad. So with that, Olivia, we thank you so much for coming on the podcast. I will post your information. We'll post the information on Thyroid Nutrition Ireland, your contact information. If somebody does want to get a hold of you regarding Thyroid Nutrition Ireland, or you as the clinician, how do they get a hold of you? Can you just share that real quick?
Okay, so for myself, you can contact me at oliviabecknutrition.com. And then for Thyroid Nutrition Ireland, thyroidnutritionireland.com. Either one, I'm going to be at the other end with getting the email. So I'd be glad to hear from you.
Awesome. All right, ladies, thank you for another great podcast. And for our listeners, if you enjoy the podcast, go to wherever you watch or listen to podcasts. Go to the where you do the review, check the farthest star to the right. That's the one we want you to check. And then share the podcast with your friends and family so we continue to grow the podcast and spread the message. All right, everybody, take care. And we'll be back on with another edition soon.
Absolutely. Bye.